Shahid. My name is Shahid Asayed, and I'm heading up the Secretariat at the Swedish Research Council for OHAMR. And I'm here today to give you essentially the overview of the partnership. Feel pretty privileged to be able to do that. I took up this role 7 months ago. I kind of still feel like a newbie, but probably past that stage now. There are colleagues both within the Secretariat as well as within the partnership who have been working tirelessly on preparation of the partnership for many years. So I feel very privileged to be able to stand here and actually tell you about the amazing program of work that has been put together and obviously then funded by the European Commission. I'm not obviously following Hatem's excellent presentation and kind of setting the scene for why we're here today. I think also anyway, many of you know why we're here today. I'm not going to dwell further on why AMR is a problem, but I did want to just capture this image and the text from our strategic research and innovation agenda, which essentially just highlights that AMR remains a problem. It's amazing that, amazingly sad, I should say, that we are still, in 2019, for instance, we have more than 1 million deaths attributable to AMR, and actually more deaths than from HIV, TB, and malaria. So we know AMR continues to be a problem, and it was really wonderful to hear Kasia's introduction to really kind of acknowledge that AMR remains a key priority for the Commission, and that research and innovation is a cornerstone to tackling that. And again, just to kind of reinforce the message of that, of course, AMR isn't just a scientific microbiological question, but it is more than that. It's a societal challenge, and we know that AMR essentially risks us achieving the Sustainable Development Goals. Of course, there's a lot of things happening in the world right now which are doing so, but AMR being one of the key global health challenges. Obviously impacting things like, everything from hunger to new drugs to economic growth and health, of course. The other thing I wanted to emphasize was the One Health aspect that, of course, is central to the partnership. We are, after all, called the One Health, the partnership on One Health AMR. We've seen this picture 1,000 times, and we've heard again from Hatem how it's all interconnected, and we really kind of need to take that holistic approach to tackling AMR, looking from the human, animal, and the environmental perspective to really understand how we can work together across sectors globally to achieve what we need to achieve, which is, of course, the reduction of the burden of AMR. The thing I just wanted to highlight here was that within the partnership, recognizing that there are other European partnerships who are also focusing on the One Health aspect, in this partnership, we will be taking a human-centric approach, meaning that we will be looking at the problems from the challenges that essentially threatens human health. So a slightly different take on it, but we're putting the humans in front and center, and we're understanding how all of the other bits of animal health, environment, and so on impacts human health. The other thing I realized as I was putting this presentation together, which is pretty amazing, if you've been working in the space of AMR for a while, you will know that last year, around about this time, there was the second high-level meeting on AMR at the UN General Assembly. And so it was at this meeting where member states decided to adopt the declaration on AMR, and also agreed to, for the first time, actually set a target, which is to reduce deaths associated with bacterial antimicrobial resistance annually by 10% by 2030. So we're really set up for the challenge. So it's a pretty amazing feeling to be standing here 1 year later and actually launching one of the key mechanisms that could do something about this, that could tackle AMR and that could provide some solutions to what we're facing here. And of course, as highlighted also by Kasia and I mentioned before, research and innovation is a cornerstone of our fight against AMR. So just a little bit of background. So OHAMR, the partnership is very much based on a very, what do you call it? Lost the word. It's based on a lot of experience and expertise in actually running a program such as this. And of course, I'm talking about the Joint Programming Initiative on AMR, which was also coordinated by the Swedish Research Council since 2011. So it's really been a journey from that program to go through the design phase of the partnership in 2022, to developing the strategic and research innovation agenda for OHAMR, to then actually now finally being able to launch the call. So we're building on a lot of great successes from JPIAMR, but also a lot of great learnings. And we then come to the vision and the mission of the partnership. So the vision of the partnership is pretty simple. It's to reduce the burden of AMR. Quite overarching, quite hard to reach potentially, but we think we have a way. So our mission is to boost the One Health research and innovation, essentially leading to improved surveillance of resistant pathogens, better diagnostics, effective treatments of infections and prevention measures, thereby reducing the use of antimicrobials and therefore the spread of AMR. And the partnership is very much built on four very important values. Of course, One Health being one of them, but also equality, inclusion, and diversity, recognizing that we are very much part of a global world here, and ensuring that we're not just focusing, although it being a European partnership, we're not just focusing on the problems of how Europe will tackle AMR, but actually looking beyond Europe. And there was also some very encouraging word from Kasia on that, really kind of reinforcing that global health aspect, but also things like gender aspects and gender equity. Knowledge valorization, very important. We are using research as a tool to achieve the impact that we want to achieve. That means we need to be able to translate the evidence that we're generating through this partnership. So very much focused on the impact and making sure that we're translating the evidence into policy, practice, as well as products. And then strengthening of the European research area, which of course, again, very much about building the resilience within Europe and building up the capacity within Europe, but also, again, looking broader than that and thinking about the global aspect, how we can build capacity not just in Europe, but also wider. And so the objectives of the partnership is really around enhancing European and global synergy, collaboration, and collaboration between the different One Health sectors. So again, making sure we're not working in silos. We want to break those silos between the multiple disciplines, an alignment of strategic research and innovation on One Health AMR. We want to boost the AMR research and innovation to generate knowledge again and develop solutions to prevent and tackle AMR. And we want to facilitate knowledge valorization of research and innovation into products, policy, and practice. So very much kind of direct translation of those values into our objectives. And so just a very quick overview of the partnership then. We have actually officially started since 1st of June. We signed the grant agreement with the Commission back then. although this is our official launch. And just to mention that this is a 10-year-long project, so we have really scope and we have time to make a difference. We are, as also mentioned by Kasia, we are 53 organizations or partners within the partnership across 30 different countries, and we are very much hoping to grow that. We are very much hoping to extend our membership to also to countries beyond Europe, and this is something that we're already actively working on. So we have 250 million euros pooled funding for our research and innovation projects, and we are then hoping that through this we will generate up to 75 million euros in EC co-funding for the projects as well as for the implementation. And just to give you an impression of what 30 countries look like, I spent a long time putting this slide together. Quite proud of myself. But here we are. At some point, we shall also make sure that we have everyone's logos, but that will wait for a bit. But we're hoping that next time we come together and we show you this, there will be even more flags on this. But I think it's quite a nice slide that really demonstrates how the world is coming together to tackle a very important global health crisis. I did want to mention our strategic research and innovation agenda, which is very much what the partnership is actually built upon. So as I mentioned before, the SRIA was published in 2023 and kind of set the foundation for the scope of the partnership. Of course, the One Health approach being there, very important, being challenge-driven. We are here to solve a problem. We are funding research to solve a problem. Cross-thematic, again, bringing in the interdisciplinarity, the cross-sectoral, making sure that we are thinking about the real-world challenges. We won't have impact unless we bring in the real world and the challenges from there. And just to emphasize, again, looking from the antibacterial perspective as well as the antifungal perspective, which is slightly different from the predecessor program of JPI AMR. And so the challenges that were identified in the strategic research and innovation agenda were these three focus areas. And this is essentially what is given the foundation for the partnership. So it's around preventing the emergence and spread of AMR, strengthening the appropriate use of antimicrobials and infection prevention control, and then also providing innovative and cost-effective treatment options. And across these focus areas, we have our thematic areas, which are therapeutics, diagnostics, surveillance, transmission and evolution, and then interventions. And just to make it a little bit more complicated, we're adding on cross-cutting areas. So all the researchers who are potentially here or have dialed in, pay attention. We're also understanding the importance of not just looking at a problem from a single side. Of course, we've heard this, the interdisciplinary approach and all of that. So the cross-cutting themes, which really will be emphasized in the research that will be funded, but also the activities, is social sciences, implementation science, innovation, as well as the global aspect and the global challenges. And that has then been translated into 4 key programs. It's the Research and Innovation Funding Program, which is, of course, a very big part of what the partnership will do, which is to fund research. The Capacity Strengthening Program, really to support training, networking, collaboration across disciplines, sectors, countries, recognizing that we need to build the resilience of the AMR workforce as well, the research, I think the AMR research community is around 3,000 researchers. It's very small, and we need to make sure that we are continuously training the next generation to continue to drive the research. We have the impact program, which is all about knowledge mobilization, making sure that we facilitate the uptake of research so that we can actually implement the findings, and we can actually translate the results into products, practice, and policy. And then we have the data exploitation program, which is I have learned immensely about actually this morning because we had a session on reusable data. And this is all about promoting the fair access and sharing and reuse of data, recognizing that there is a lot of data out in the world, a lot more will be generated, and we need to make sure we're actually dealing with it in a sensible, holistic way. And these 4 programs have then been translated further into actionable work packages. And we've got 6 different work packages. And I will actually be bringing up the work package leads onto stage. We will proceed to have a panel discussion shortly. But the 6 different work packages, quite directly translated from the research programs, are the coordination and the management, which of course, as the coordinator, the Swedish Research Council will be is leading on. Then we have work package 2, which kind of ties in or connects all of the different work packages because it's all about international alignment, strategy, collaboration. And it's our DLR colleagues who are leading on that. We then have our work package 3, which is the Research and Innovation Funding Program, headed up by ANR in France. And then we've got work package 4, which is the Capacity Strengthening Program, led by the Ministry of Health in Italy. And then our data exploitation program, work package 5, headed up by ZonMV in the Netherlands. And then finally, our work package 6, which is all about the knowledge valorization, impact of the evidence generation, headed up by UKRI in the UK. And then I just wanted to give you a little bit of a sort of quick view on our governance structure, because here I think this is important to highlight that there will be opportunities for stakeholders and obviously new partners, but also non-partners to officially interact with the partnership. So our main decision-making body is the General Assembly, and this is essentially all of the members in the partnership, as well as the European Commission. So here, obviously, to be able to get a seat at the General Assembly, you need to be a partner. But then we have a range of advisory bodies, and if you're there, you're listening, you're potentially interested, this is where you should definitely pay attention. So we have the Strategic Board, which is an advisory body to give strategic advice around alignment of national and international strategies, very much kind of thinking about the more high-level aspects of driving the AMR agenda. And while we will have the member countries from the partnership, there will also be a possibility for non-member countries to actually join the strategic board, because we need to make sure that we are aligning not just within the partnership, but also outside. We will also then, of course, have a scientific advisory board. That's pretty straightforward. And then we're also setting up a stakeholder forum, which is incredibly important because this gives us the opportunity to interact, get advice from the end users, which is, of course, incredibly important so that to understand the needs of the end users so that we can then plan the research calls accordingly. And here, there is a possibility for interested parties to take part as we will be setting this up. And then finally, also an ethics advisory board. And this is my final slide, I think. I just wanted to give people a little bit of an idea of what we will be doing in our first year. This is a simplified version of what I showed to the General Assembly yesterday. but still captures some of the main activities that will take place. So we obviously have our kickoff now in September. We will be pulling together a finalized communication strategy at the end of October, which is incredibly important. We need to make sure that the word gets out. We're launching our first call in November, hopefully during the World Antimicrobial Awareness Week. We will be having our first annual meeting in Vienna next year in March. And then all of the work ahead for year 2 of the partnership will be planned in the annual work plan and submitted to the Commission in April. And just to say that we have just kicked off. We are very much in the setup phase at the moment. We are building the foundations of the partnership. That means we are also setting up a lot of the advisory bodies at the moment. We're drafting the rules and procedures. We are looking at potential interested organizations or experts. So again, it's a little bit of a flag to interested parties, stakeholders, organizations, countries, to potentially get in touch, because this is when things are happening. This is your chance to get involved officially with the partnership. And I do have one more slide, and this is just to flag that our first call of the partnership again, which will be announced in November. We're working very hard to finalize all the details. And this call will focus on focus area 3, which is providing innovative and cost-effective treatment options. We have an estimated budget of around 35 million euros. Please look at our website, follow us on LinkedIn, Blue Sky, to learn more about the call once it comes out. And, oh yes, I did want to just say also who we actually are. So the Secretariat is based at the Swedish Research Council in Stockholm. And we have a wonderful team of which actually everyone is here. So if you're seeing someone that you would like to speak to, then just let us know and we can direct you to that person unless you catch them at the mingle. But we're all here today to make sure that we're available should there be any questions. And then I also wanted to show the coordination unit. So this is an important function in our governance structure. We are essentially the people who are running who are managing the sort of the strategy and the kind of the operational side of the partnership. It consists of, as I mentioned before, all the work package leads, we meet on a regular basis to make sure that we are driving the program forward. And with that, I am finally done.